It's the biggest story this year and perhaps even the past century. The coronavirus pandemic has eclipsed all other news across all media platforms. It's an unprecedented amount of coverage on an issue that, frankly, just a few months ago, the world knew nothing about. Each week, the show will look at how that story is unfolding, who's telling it, and are they doing it well? We'll explore the editorial and personal challenges that journalists face, the logistics and ethics of covering the single topic on a 24/7 news cycle, and the roles and responsibilities the media has in how it informs the public. I'm Ali Aslan, and on this edition of Corona Times, we'll take a look at why news loves grim milestones as the world's media mark the 1 millionth case of coronavirus.
The global outbreak of COVID-19 has just reached a grim milestone.
Global infections surpass 1 million.
We start this morning with an unwelcome milestone being reached.
More than 1 million people across the world are now infected with COVID-19.
The spread of the coronavirus has passed a significant milestone.
The worldwide total of confirmed COVID-19 cases now surpassing 1 million.
More than 1 million coronavirus cases have now been confirmed across the world.
The number of novel coronavirus infections crossed 1 million.
There are now more than 1 million confirmed cases of COVID-19 worldwide.
1 month ago, there were less than 100,000 cases of coronavirus across the globe. Today, there are more than 1 million.
Well, as you saw there, on the 2nd of April, more than 1 million positive cases of coronavirus were confirmed worldwide. That was according to Johns Hopkins University in the US, which TRT World also uses as our official source for the numbers we report. Meanwhile, predictions in the press of those who might die in the coming months range from 200,000 to more than 2 million. That's down to everyone using different metrics to measure the scale and spread of the outbreak. The result can be an audience hungry for information, left waiting in a numeric soup while media outlets publish streams of numbers, often without context or consequence. That's our feature story in this week's Corona Times. To talk about what stories those numbers can tell us, I am joined by three professionals whose job is to make sense of all of it. In Birmingham, in the UK, is data journalist Paul Bradshaw. He's the author of the Online Journalism Handbook and has trained journalists in countless newsrooms on how to use data. In Brussels, we have Stephen Erlanger. He's the New York Times chief diplomatic correspondent in Europe. And Amanda Makulec joins us from Washington, D.C. She's a data visualization expert and the author of 10 Considerations Before You Create Another Chart about COVID-19. Steve, we just saw the 1 millionth case worldwide. Why do you think the media, why do you think journalists choose to mark reaching a milestone like this, million cases, as some sort of event?
Well, we like big numbers. We like round numbers. Just wait till it hits 2 million cases, then we'll have to go through the same repetitive cycle all over again. The problem is we're not even sure that that figure is correct because we're getting all kinds of data from all kinds of different countries and different people are testing at different rates. And my guess is there are a lot more people walking around with the virus than even these numbers indicate.
And Paul, data, of course, is significant, is key here in reporting and covering this story. Yet most journalists, of course, are not data experts. What responsibility do journalists have in times like these?
I think this story in particular will emphasise the responsibility that journalists do have to understand statistics and data, and those are not necessarily the same thing. But certainly there are things that all journalists should be getting to grips with if they haven't already, things like margins of error, things like false positives and false negatives. And it's absolutely vital that they understand this because as journalists, we're often having to deal with data and we need to be able to understand that clearly enough to communicate that effectively to an audience.
Amanda, what is the significance of the number 1 million when it actually comes to conveying the seriousness of the pandemic to the public?
So we've seen a lot of different visualizations and maps that have been tracking the path towards this 1 million case milestone. And I think my co-panelists called out key issues around the certainty of that data. Are those numbers even accurate and correct given what we know about testing rates and other issues? And so as we think about reaching that milestone and how that gets plotted on charts and graphs, we can see that people are taking that as being fact, that we see this climb towards 1 million cases, when in all actuality, we can guess that we reached that milestone a while ago. We just may not have had those confirmed cases. And this is where I think journalists can do a great job at clarifying with text and other information the difference between, say, a confirmed case, the cases we can count, versus the estimates of cases that we have around the world.
So if I understand you correctly, you doubt the numbers, you doubt the actual numbers that are out there.
I think that that is the number of confirmed cases that have been laboratory confirmed or otherwise quantified and counted by different national health information systems. But what I worry about is that the number of confirmed cases we have is really a function of the number of tests being done and how many people we can confirm have the virus. And so that means that the number that we're seeing may not be a fully accurate representation of the total count of cases around the world.
Steve, of course, most journalists out there are not scientists, and they don't perhaps fully understand the numbers and the figures they put forth. How responsible is that? Is that responsible journalism?
We need to be very careful. I think, as everyone says, we need to put it into context. But one thing we do know as journalists, and this is an important part of this story, is some governments lie. The data coming out of certain parts of the world is not reliable. It's from China, for instance. Its economic data is considered largely unreliable. And there are lots of questions about whether its data on the number of deaths and number of cases is also reliable. In Russia, people seem to have very few cases, though if you look at what's been going on in Russia, one would tend to doubt that. A Russian doctor was just arrested for saying it was worse than what her own government had said. And in North Korea, apparently, there are no cases of any kind. So as journalists, we also have to be skeptical, not just of how we use the data, but from where the data comes.
A healthy dose of skepticism is indeed very warranted these days. Paul, now, as we said before, TRT World, including many other news outlets, are using the Johns Hopkins figures to determine the rate of the cases of death and cases worldwide. Now, what purpose then do journalists serve? I mean, at the end of the day, any citizen out there could go to the website of Johns Hopkins, no?
An absolutely vital role because, first of all, if someone does go direct to Johns Hopkins, there's no guarantee that they're going to understand some of the issues that we've already mentioned today. I actually believe that the map that's used by Johns Hopkins is not a very effective device for communicating those numbers, because what we're seeing here is the size of land. We're not seeing the numbers of people in each of those countries. So it's actually quite and the use of red is quite an alarming device. What journalists do is, first of all, we translate this information, so we put it into plain language. Johns Hopkins' audience is primarily scientific. It's not the mass public. But also what we do as journalists is we make it meaningful, we illustrate it, we check it, we put it into context. We find the human stories that make this meaningful. So I might look at a map and, okay, there are big red circles on there. How does that affect me in my neighborhood? Should I really go out? Should I change my behavior? What journalists will do is find stories near me, people like me, people whose authority perhaps I respect or whose opinion is important to me. So as journalists, we play a massively important role in bringing that information to a wider audience and engaging them in it, persuading them that this is something that they should be reading about.
The role of journalism very key here in transporting these numbers to a wider public, putting them in context, says Paul Amanda. Would you agree?
Absolutely. I think that journalists have absolutely played a critical role in going ahead and making sense of those numbers, making them human, communicating complicated topics like the concept of flattening the curve, using, say, the animations that were done by the Washington Post to try to make something that might be hard to understand for a broad public that doesn't know fundamental concepts of, say, epidemiology, to understand what that looks like and what the actual implications are for our individual choices. And I've also really appreciated where journalists have dug in and tried to make sense of some of the more disaggregated figures and the concepts around what are the larger worldwide and even national here in the US effects of things like social distancing. And I think journalists have played a great role in helping to amplify and help us to understand why we should make the certain choices that are being recommended to us around social distancing and hand washing, but also making sure that people understand the stories around them and make this big global issue really local.
The role of journalism key here. Stephen, someone who's been practicing and displaying journalism for many decades on the forefront. Would you agree that this is a very, very key and essential moment for journalism?
Well, it is, because we are fulfilling a kind of public role that we don't often get the chance to do. We're supposed to inform, of course. We're supposed to present what actually matters. But in this case, you have governments who are sometimes very worried about other issues. My own government, for instance, has been very worried about the effect on the stock market. And its favorite television station, Fox News, has been playing a very odd role, really, at first downplaying the importance of this virus and trying to support the president. So in a partisan political place, which is what the United States now is, I think, mainstream media, which does try to rely on expertise, has a very important role to gauge what governments are saying, what experts are saying, to try to put a human face on what is a really difficult story, and to try to actually explain the fear, because this is a kind of terrorism, but it's very different. I mean, it's invisible, it's insidious, it divides people one from the other. So I think we have to play a very important role reminding people of others going through what we're going through, of the heroes of this crisis, and of our, if I can be banal, our shared humanity.
A shared humanity, more essential and important than ever in times like these. Thanks for that. We'll all come back to you in just a little bit. Well, as we just touched on with our guests, numbers are central to covering this global pandemic. It's a story that will continue to be told using all manner of statistical data. But how it is sourced and presented determines how it will be interpreted by a larger audience. And whether we hear it from a politician or read it in a newspaper, those numbers can be used to both inform or mislead. Adam Platz has more on the difficulty of data.
Data is only as good as the process that collects it, only as honest as the people who produce it. The US certainly has its reservations about the validity of China's coronavirus figures.
Their numbers seem to be a little bit on the light side, and I'm being nice when I say that, relative to what we witnessed and what was reported.
Authoritarian regimes in particular seem to prefer to control the data rather than release it. But even when it's transparent, there are a myriad of reasons why it's not necessarily consistent. Different tests, levels of accuracy, and varying classification criteria among them. The jump in the number of Chinese cases on February the 11th was due to a reclassification of what constituted a confirmed case, and the number of verified infections is only a function of the number of tests done. Some countries have the capacity to do many, others scarcely any. The truth, at this stage, is that nobody perfectly understands the extent of the pandemic, nor its effects. Estimates from different epidemiologists in the US vary wildly as to how many deaths it could cause. And while the experts try to model the virus, many politicians have turned a convenient blind eye to the data, preferring the best case scenarios that allow them to keep the economies of their countries running.
Che in Italia è un paese sicuro, è un paese su cui si può viaggiare, si può venire a fare del turismo.
As data about the spread of the virus led public health experts to advocate a policy of social distancing, in Brazil, President Bolsonaro was still shaking hands at rallies. In fact, he's been dismissive of the outbreak's severity.
Depois da facada não vai ser uma gripezinha que vai me derrubar não, tá ok? Se o médico ou o Ministério da Saúde me recomendar um novo exame, eu farei. Caso contrário, me comportarei como qualquer de vocês aqui presente.
Many political leaders have downplayed or misjudged the gravity of the outbreak, but it's a matter of record that journalists were among the first to raise the alarm, one that often fell amid allegations of fake news on deaf ears. According to research by PR firm Erlanger, journalists are the least trusted source for coronavirus information. But that, in itself, is more data, which, as we've seen, isn't always what it seems, something that journalists and politicians must bear in mind. Adam Pletz, TRT World.
Well, as we heard there, data is only as good as the means by which it is collected, and only as trustworthy as the people who produce it, or perhaps only intelligible to the extent that journalists truly understand the numbers. To speak more about that, let's go back to our panel. Amanda, how does one actually choose the right data source? I mean, what are the dangers of choosing the wrong one?
So we've seen a lot of folks rely on the Johns Hopkins data source, in part because it was one of the first that was made open, available, easy to download, and easy to interact with, both through the online interface and through the GitHub repository that they provide. We've seen a lot of folks who go to that source because it has clear sourcing. It indicates where they're getting their numbers from. It speaks to the fact that they're sourcing their data from large agencies and different national systems. And so it creates one common point that we can go to and use as a shared source of information. I think it's important, though, to think about where we are seeing other ways of bringing data together and thinking about what data you need to tell an effective story. So, for example, in the US, the COVID tracking project has been working on actually bringing together data from different state departments of public health and including information on the number of persons tested. And so if the story that you're looking to craft and the journalism piece that you're creating focuses not just on the case numbers, but on tests, looking to other sources that have reputable good sourcing can be a good way of bringing that data together. And so when we look for additional information, we need to just make sure that it's coming from sources that we can rely on.
Stephen, what are some of the ways journalists can be misled by numbers and statistics?
Well, we're very easily misled because very few of us have been even mathematicians. So the calculator helps a great deal. I'm joking a bit, but it is very important to see that we're comparing like to like. In other words, if you're comparing the rise of deaths or the rise of actually confirmed cases, it's really important to try to use the same data sets, if at all possible. It's also really important, as one of our panelists said, to look at things like margin of error, particularly when we're actually doing polls. And it's very important to look at the time period in which the data has been gathered, because obviously that makes a tremendous difference. But we should also be very, very careful, I think, about projections, because the projection into the future is changed every day by what we do as people, what we do as governments, what we do as individuals to change our behavior. And every time we change our behavior, we will obviously affect projections. So almost all projections are based on a set of assumptions, and those can change very, very quickly.
Paul, what are some of the key mistakes that you see out there that journalists make when interpreting the data out there?
I think the point about cases is a really key one. Really, that measurement isn't very helpful at all. because, as your piece pointed out, really what we're talking about is how many people have been tested. And testing has varied so much in different countries. In the UK at the moment, there's a lot of concern about just how few tests there are and have been. And so it's very difficult to compare the number of cases with others. And it is very important when you're talking about data to be very clear what you mean. Some of the presenters in the examples at the top of your program talked about infections, when actually what they were talking about was confirmed infections, or people who had been confirmed as infected. So being very accurate with language is very important, and using metrics that can be compared. So deaths is really probably one of the most reliable pieces of measurement we can look at. And even that has its flaws, because in some cases we might only be measuring deaths in hospitals. In other cases, we might be measuring deaths outside of that situation, in care homes, for example. So it's easy to make that mistake of using a measurement which is not comparable with some other measurement that you're using. So making comparisons that really aren't necessarily effective or accurate or reliable.
Amanda, most people out there, most consumers, of course, are not experts. What would you advise journalists? How can they help put this story into context to a much wider audience out there?
I think that the key to communicating this effectively is to find ways to plot information that is simple and easy to understand, but that doesn't ignore the uncertainty in the numbers. So as we think about how charts and graphs get shared and get used, oftentimes people are taking little screenshots or just sharing them outside of the context of a full article. So how can the charts and graphs that get embedded in different pieces include all the critical information someone needs to understand about that data story? So for example, reference lines like noting where China changed the way they were quantifying cases so that we understand why we see a jump in that specific point, or including very clearly what the date and time at which the data was pulled for a given report or a given graph. If that data is just embedded in a footnote somewhere, it's easy for that same chart to float around social media for days at a time and people not to realize that it's not the most up to date. And I'm struck by your note and your chart that you presented about the comparison between who people believe, journalists or really friends or coworkers or others, about where they're getting information about COVID-19. And I think that that's where it's important for all of us to consider how we're sharing news and information and how we're amplifying some of the great work being done by journalists that includes a lot more digging into the nuances and complexities of the story. And it creates a challenge for folks in the larger data community who want to dive in and test out models and make charts and graphs. But when those get shared in the public domain, they may be misleading. They may not be informed by accurate, good public health or epidemiological information. Making forecasts of this is very complex given the number of changing parameters. So as people are consuming information from journalists or others, it's on all of us to go ahead and look at what the sources are, how those stories were created, and what the key takeaways are.
Steve, speaking of key takeaways, every morning the whole world wakes up to horrifying news about the number of cases and death being increased worldwide. How do you as a journalist strike the right balance between conveying this very important message, conveying important information without contributing to the fear out there, without sounding too alarmist?
Well, I think it is very difficult because, particularly in America, you have partisan fighting even over the facts. So it is very, very difficult. I think you have to be careful in the way you use your language. You have to be careful not to pretend you're in the middle of some sort of science fiction movie, which I think people are very. It's very easy to scare people. I mean, people feel very, very vulnerable. People look around, they don't see the virus. They're being told to wash their hands. They may have friends who have it. I have a friend who actually died of it. And you always think it could be me. So this is the kind of thing journalists have to be careful about, but we also have to put it into the context of, for argument's sake, I mean, I don't know the figures offhand, but compare it to the number of car accidents that, for argument's sake, people die from flu every year. People die from falling into the bathtub. It's very important to put all of this into a kind of context. One of the things I try to do is, again, comparing like to like, is looking at the increase of deaths in particular to see whether they begin to level off in particular countries, to see whether countries have actually begun to reach a sort of plateau, which gives you the hope that perhaps the number of extreme cases will then be going downwards, the so-called flattening the curve. I think that's the kind of thing we should keep reminding people about, that this has a wave, and if our behavior is intelligent, we can affect the severity of this outbreak and come through it.
Come through it indeed. Hopefully we all will at the end of this process. Stephen Erlanger, Paul Bradshaw, and Amanda Makulec, thank you so much for joining us here on Corona Times. And that's it for this week's show. As we continue to examine the role and responsibilities the media has, we are aware that includes us too. So if you have any thoughts on how we're doing, do get in touch. You can follow TRT World's ongoing coverage of the coronavirus pandemic on YouTube, Twitter, and at trtworld.com. From me, Ali Aslan, and the team here in Istanbul, thanks for watching and see you next week.